Good afternoon and welcome to the virtual town hall on COVID-19 vaccine confidence in diverse communities with our partners, WUSA 9, the COVID-19 Vaccine Education and Equity Project, and Kaiser Permanente.
Come on, y'all. Let's have church.
On any given Sunday,
Delivered by the power of God.
You'll find Reverend Matthew Watley, senior pastor of Kingdom Fellowship AME Church, delivering a message of hope and frank insight
I stand up and say what thus says the Lord.
to thousands across the country.
I can't get no help there in the virtual world. Come here, Martha. I need a witness in the house.
COVID-19 has impacted this house of worship that serves nearly 6,000 from its empty sanctuary in Silver Spring.
We've had family, church members of our family who have lost both parents to COVID within small spans of time, and then not even being able to bury them. It really has become a pastoral burden to know that your voice matters not just in the saving of souls, but also in the saving of lives.
Let's end COVID, Marilyn.
We've been taking vaccines our whole lives.
Reverend Watley and First Lady Shauna Watley are part of a new push by Maryland Governor Larry Hogan to reach people in black and brown communities with leaders they trust. But the pastor's wife will tell you he was already in motion when the state called.
He was like, Shauna, if we don't tell folks to get involved in the trials and take the vaccination, then we're going to continue to lose people in our community.
Last spring, Reverend Watley started making calls to clergy around the nation. They teamed up to help educate their congregations.
I'm here at the Clinical Research Unit at Howard University, about to take the Novavax.
Hoping to tear down fear and build up confidence in the shots.
Here we go. Look, I'm getting the shot.
Then he decided to roll up his own sleeves for science.
I didn't serve in the military. I'm not a healthcare worker, but this is one way that I feel that I can contribute to larger society.
The Watley family has felt a direct impact from the virus. The pastor's 90-year-old grandmother battled it, and Shauna did too back in August. She still struggles with the fatigue.
I was fortunate, but I could have been a worse case. And that, I'm still not out of the woods. As American citizens, it's not just about our own selfish needs. It's about protecting our families and also protecting others.
And for those who want to wait and see what happens before taking the vaccine,
Every day you wait, you keep yourself susceptible to the virus. And not just you. You're most likely to infect your friends and family members and loved ones. But it also suggests a moral challenge. Because if you're saying, I want to wait to see how it works, what you're really doing is saying, I want to use others as guinea pigs.
this family of faith believes the trials and the vaccines themselves offer all of us a chance to serve, something they believe we are called to do.
Let me see if I can help you.
To return to the lives we once knew.
Whatever you ask of God, He will give to you.
Please welcome our moderator for today's virtual town hall on COVID-19 vaccine confidence in diverse communities, award-winning journalist Leslie Foster.
Good afternoon, family. And I use that term because I believe that it signifies our shared humanity and interconnection. And what you just saw and heard was a story about how some are trying to help build confidence in the communities that have been hit first and worst by COVID-19. It will take all of us for sure. So I anchor the evening news at WUSA 9, but I'm delighted to be with you earlier today to have this very important conversation. And we are grateful for you devoting an hour of your time for this courageous conversation around this virtual town hall about COVID-19 vaccine confidence in diverse communities. So confidence is the belief or the feeling that one can trust or rely on something. And as we navigate this pandemic together, we will need to continue to build on that firm trust and this most significant tool that we have to emerge from the grips of this scourge. And so our partners today, as you've heard, are the COVID-19 Vaccine Education and Equity Project, which is a coalition of nearly 150 patient, provider, and public health programs that have come together to advance public education and equity around these vaccines, and of course, Kaiser Permanente, which is one of the largest nonprofit healthcare plans here in the United States, which exists to provide both quality healthcare and affordable healthcare to improve the health of both its members and the communities that it serves. We convene today, though, with the knowledge and heart of 4 committed servant leaders who have endeavored through their own life's work to help educate, elevate, and really eliminate the barriers to critical resources, not just during this crisis, but in the quest for greater health for all. So allow me to introduce you to our panelists today. CEO Anita Jenkins is the energetic and enthusiastic CEO for Howard University Hospital Adventist Healthcare. She is a former respiratory therapist who worked in trauma units and received her COVID vaccines quite publicly several months ago in her quest to help build confidence in the science behind the shots. She's also a mother of 5, helping her own family navigate this health journey. She has a physician daughter who has had her shot and a son who is a police officer who has battled COVID and is awaiting his shot. So she sees this big picture, and she is what I call a mama bear who cares for those that she loves and those that she serves. Dr. Uzma Syed is an infectious disease specialist and chair of the COVID-19 task force at Good Samaritan Hospital Medical Center in New York. And she's also a representative on behalf of the American Muslim Health Professionals. In her free time, when she is not caring for people in need, which of course is a very full-time job, she is the founder and CEO of a nonprofit called Align Us that mentors high school students. And she also helps to supply toys and food to children and families in need. You'll also find her on social media answering questions and sharing her own inspiring story of her journey to medicine and her Muslim faith. And so we welcome Dr. Syed as well. Dr. Tanisha Cheatham was appointed physician-in-chief of the Mid-Atlantic Permanente Medical Group for the Baltimore service area with Kaiser Permanente back in August of 2019. But she spent 15 years prior to that working with patients primarily in Prince George's County. She is a mom to 3 older teen boys. She is a board-certified family medicine physician who currently practices across the Baltimore service area. And she said to me that she believes that medicine is really all about developing relationships with people, being part of families' lives, and impacting generations. And finally, we have Dr. Reed Tuckson, who has been a leading voice in healthcare issues around equity and access to care for the past 35 years. Currently, he is a founding member of the Black Coalition Against COVID-19. He's been a commissioner of health for DC, the former president and chief of medical affairs for United Health Group, and has shared his expertise on everything from health reform to violence, radiation testing, even serving on a myriad of boards. And he is what we call our health senior statesman as managing partner of Tuckson Health Connections. But among this group, we call him the closer. And he will have a powerful call to action to share that will have you standing up at the end of this Zoom session. I hope I have created a lot of excitement for you, because there is certainly a lot of excitement among us. Each of our experts will have some opening remarks that they've prepared, in part prompted by a quick question, and then we'll dig a little deeper into this conversation. And of course, we will work in your questions too, because this is ultimately about you, your clarity, your confidence, your comfort in this life-saving tool to help us get to some semblance of life as we remember it. So why don't we start with CEO Jenkins? And you had to build the confidence of your own healthcare team before you could even think about building confidence in the public you serve. What do you see as the employer's role in building that confidence in COVID-19 shots, particularly in diverse communities, which are served by diverse healthcare providers?
Thank you so much for having me at this very, very important town hall. Yes, I have a high level of a quote unquote diverse workforce. And while we had battled COVID-19 and we had seen so many die, and we saw the inequities, the high level of Black and brown people who were ill with it and passed away from it, there still was fear. I was excited when we were getting close to having an approval for that vaccine, and we started having this conversation. I had a Zoom call with 120 of my leaders, and we were talking about being ready for vaccines and talking about it, and the chat room blew up. What about Tuskegee? What about health inequities? What about trust in physicians? Are you going to get the same vaccine that everybody else gets? That fear was still real among healthcare providers, even though they had seen this very, very tough fight fighting COVID. Leaders really have a responsibility to build relationships, to inform their team, to build trust, and then to lead. On that very same call, I started seeing lines that said, if you take it, I'll take it. I need to see, if you take it, I'll take it. I was happy to step up, and I called it first to fight. If you need to see me, if you need to see me take it, I'll happily do that. And so we did. It was very interesting. And then they really did say, I will step up. One of our most vulnerable groups in many hospitals is the EVS group, which is predominantly Black and brown in many hospitals. Our director, he's such a leader. He said, then if you take it, I have to take it the same day to tell my team. It was very important for us to be seen, very important for us to show, very important for us to still address those real fears about history. Can we trust it? Can we trust the science? Can we trust it? And so as soon as we started having these questions, we sent out information sheets every day about what the vaccine is, how the clinical trials, the fact that there's 10% Black and brown people were a part of those clinical trials, and what those trials are showing. We had to inform, and then we allowed people to really ask their questions. And I have great scientists at Howard University, and so we had the best answers, and they were able to answer through me. So trust, talking, and being an exemplar was the way that we were able to get started at our hospital, where 70% in a survey said in the beginning, 70% said, we're not going to take it. And now we are absolutely in the norm. 50% have taken the vaccine thus far.
That's an incredible number there, CEO Jenkins. I'm going to bring in Dr. Syed to our conversation now. And you heard the CEO talk about really having to listen. And you've talked about how any kind of breakthrough in understanding, Syed, starts with listening. What do you say to your patients about the importance of these COVID-19 vaccines?
Absolutely. I mean, these are conversations that are happening every day. I can tell you from someone who's been on the front line of this pandemic for over a year now, the amount of despair, disability, and death that we have seen, not only in my patients, my community, but worldwide, has just been tremendous. You know, more than a year into this pandemic, and we still have no magic bullet. We don't have a cure for COVID-19. So the thing that's really important to remember is that these vaccines are really the strongest tool that we have in our toolbox right now to really help win this fight against COVID-19. And that's a message that has to really resonate with people. And it's really difficult because even though we've lost close to 500,000 people in our country alone, and millions of people have lost their lives to COVID-19 worldwide, it's hard for people to relate to numbers. And what we have to remember is that every single person who has lost their life has been somebody's family member, has been somebody's friend, has been somebody's coworker. So we need people to start, relating to that as innocent people losing their lives, and to really see the reality of what's happening across the hospitals throughout our country and throughout the world. And that this pandemic, the only way that we're going to get ahead of it is really to build that confidence in these vaccines. And the best way to do that is by engaging in really honest, open conversations that are non-judgmental. Start listening to people, start listening to patients, start listening to community members. Ask them, what is their insight into these vaccines? What are their concerns? And really have that open-ended conversation to start building that confidence and develop that relationship.
All important things to consider for sure. Dr. Cheatham, I'm going to bring you into the conversation now too, because you helped to oversee care for more than 130,000 people in the Baltimore area through the Kaiser Network. But as Dr. Syed and CEO Jenkins have mentioned, a lot of your time has been spent in these really deep conversations, having to listen and to talk to people and to dispel a lot of misinformation, which seems to be cycling considerably in Black and brown communities. So what is Kaiser doing specifically to reach Black and brown communities that you believe will build build confidence rather in this vaccine?
Thank you, Leslie. That's an excellent question. And what I would say is for our organization, we're really committed to this education effort. So we've been working with the Maryland Office of Minority Health. We've been partnering with our community partners to expand information about the vaccine and access to the vaccine across the state. We have a program up in Baltimore that goes into beauty salons and barbershops called our Good Hair, Great Health program, where we're talking to the community, not only about disease processes that affect the Black and brown community, but really now talking about answering all of their questions about the COVID vaccine and why they should really trust what we're asking them to do. Last week, I hosted a Facebook Live event with some of my colleagues, African-American colleagues, to talk about our experience about receiving the vaccine and to display, to allay some of the fears about some of the COVID vaccine myths. We've been writing articles for our community papers. We're giving media interviews and participating in events like this to really help get the word out to be able to trust us. Another thing that we're doing is we have these I got my COVID, I got my shot button, right? To have as a conversation starter, so that when we're in the exam room or when we're talking to people, because a lot of times you can't really see us behind the mask, but this will be a conversation starter to say, like, I got my shot. What can I answer for you? How can I help you to get this shot and let me help you get there? We know that supply is very limited. We're using in Kaiser Permanente a population-based, a very intentional appointment outreach process to help vaccinate our eligible patients. We've emailed, we've mailed letters, we've actually texted our oldest patient population, eligible patient population, to help them, right? Right now, it's been really tough, even trying to navigate where people can sign up for appointments, how they can. People don't always have the internet, are not always necessarily computer savvy to even really figure that out. So we're really trying to do that. Within Kaiser Permanente, we vaccinated almost 34% of our patients we vaccinated in Maryland alone have identified themselves as Black. So we're really trying to meet our patients where they find the best ways to get the information about the vaccine. And so we're really trying to partner with everyone that we can to really try to get the word out, to educate as much as possible.
Yeah, it's interesting that you talk about the antennas, right? Because people will talk to you as the doctor, but they'll also talk to their barber, their hairstylist, their auntie, their church member who may have said something that you as physicians didn't say. So you've got a lot of competition in this effort to really try to combat misinformation and spread the truth. You know, Dr. Tuckson, your life's work has always been about equity in healthcare. And what we've seen with this COVID virus is that it has exploited the holes that have existed for generations. And so I wonder what your perspective is on COVID-19 vaccine confidence and how you're working to address these concerns within the Black community.
Well, thank you very much, Leslie. I appreciated that. And one of the great perspectives and sadnesses from that perspective that I experience every day in this fight is I was privileged to be the Commissioner of Health in DC, as you indicated in the introduction, during the height of the HIV epidemic in the 80s. Then the single most important rate limiting step to get our community to be able to do the things that we needed them to do to save their lives and protect their loved ones, the rate limiting step was the OGRA of Tuskegee. That horrible disaster of an experience remains so firmly implanted in our community's mind, in our that it out to the scientific guidance that we were trying to give them in that particular era. And now, sadly, tragically, 40 years later, the number one rate limiting step, as Anita Jenkins just mentioned, comes back to Tuskegee. This sense of distrust by our community that is so hard earned, so deeply planted, the seeds are inside of our culture, seeds that are watered every day through our experience with multiple elements of our American society, whether it is the criminal justice and police elements of our society, whether it is the political machinery of our society, or whether it is the health apparatus of our society. Every day, those seeds of distrust are watered. And that's tragic because, Leslie, the key thing to understand is distrust is not an emotion without consequences. Distrust leads to death. It leads to preventable misery and suffering. And so what we're trying to do with the Black Coalition Against COVID is we brought together all of our leading medical schools, our 4 Black medical schools, Howard, Meharry, Morehouse, and Charles Drew, along with the NMA and the National Black Nurses Association. And the reason that is important is because what Anita Jenkins said is that messages need to be delivered to our community from trusted sources. Thank gosh that America's Black medical leadership is trusted. And secondly, it's important, as Dr. Saeed says, we have to lead with compassion and empathy. We made a statement to Black America from all of these Black health organizations that began with one fundamental premise. We love you. We love our community. We are from the community ourselves. We grew up as part of the Black community. We understand the community. And so finally, I would say to you, Leslie, that what I see as being the focus of our work today, and it's certainly the focus of my life today, is to provide accurate, trustworthy, usable information that will help us to save our lives. Let's not forget, we're the ones doing the bulk of dying, and we're close to, in America, 500,000 people who will have died very shortly from this terrible disease.
When you think of the numbers, we talk about this quite a bit, just 500,000 lives lost. And the scope is so vast, and it's so hard for people to wrap their brains around that number. The loss is so significant. And we've got some questions to get to that we have for all of you, but there's one question that seems to be coming up in the chat, and I think it's important that we go ahead and address it right now, which is, how do we really break through these years of historical mistreatment by the medical community towards people of color to get them to a place where they are willing to take this vaccine? That, from beginning to end, as you mentioned, seems to be the infrastructure that is causing so much of this issue. And so, Dr. Tuckson, if you want to take it first, how do we break through?
Well, let us be very confident and energized and optimistic by the work that's going on, by all of these kinds of shows. What you're doing here on this extraordinary, wonderful public service that you're offering, by continuing to put facts in front of people. That's how we do it, by having not only physicians, but other people of influence, whether it is the people who speak as Reverend Whatley does from the church pulpit, from our entertainers. We are hitting this issue from everywhere we can with facts. The good news, Leslie, the good news is that when the vaccine administration efforts are stood up, Black people are lining up in much greater numbers than the supply of the vaccine. We have seen from our own polling that we've been doing with blackdoctor.org website over the last months, we've gone from 60% saying no to now only 28% saying no. So the curve is moving, and the way it moves is by continuing to speak truth to our community and encouraging and reminding everyone that, as one of the great community activists in DC said, if you keep looking to the past, you're going to die right here and in the future.
Well, that's why we call you Reverend Tuckson in your free time. There is another question that came up in the chat that I'd actually like to pose to Dr. Syed and Dr. Cheatham. because this is someone who wrote in and said, I participated last week as a panelist in a webinar hosted by a large minority church for its members. And one person asked, and this is a quote, "My body is a temple. Would God want me to put this in my body?" And what would be some effective approaches for addressing this concern? Dr. Syed, I know we've talked before about concerns within the Muslim community about what's actually in the ingredients in the vaccine. Some things that, maybe some people hadn't thought about, but that was giving folks some pause. So, but to this whole point of your body's a temple, and would God or whoever you worship want you to do this, what would you say to that?
So Leslie, this is a great question. Thank you so much for bringing this up, and kind of I want to piggyback on what Dr. Tuxton was saying, and with that opening clip that we saw, what we're seeing now is, the amount of collaboration that's happening across the nation, this joint effort from every aspect, especially from faith leaders. I'm on this roundtable with faith leaders across the US that's working on exactly this initiative to really build that confidence within communities. So the important thing with these COVID vaccines is that these are new. And although there's been so much scientific breakthrough and there's been so much emphasis on the development of the vaccines, the infrastructure for the education before the rollout of the vaccines was not put into place. So what we're having to do now is play catch up with all of this. So we're having to do these kind of forums, which are so much needed to really educate the public and reach those people in their communities. But what better way of doing that than to reach people in congregations, because they have that relationship already with their congregations. And so what we know what's true across all faiths is that, the reverence for a life, the importance of a life is so valuable across all faiths. And we know that saving a life means so much. And so that's, what we have to reach people where they are. You have to know who is delivering the message. Is that message getting to the person that you're trying to get to? So it's really important that you have the right person delivering the message and that you are delivering the accurate message as well. So in that, the communication is really key. And as you mentioned before, something similar in the Muslim American community, and as we talked before, the misinformation has been spreading like wildfire across all communities. And in the Muslim American community, there was this concern about the ingredients in the vaccine, and would that be forbidden for Muslims to take if there was, any pork derivatives in the vaccines. And we know that there is no such thing. But again, that misinformation spreads very, very quickly before the accurate information and the facts are put out there. So what we're having to do is undo all of that misinformation and debunk all of this. So these are just ways that we can approach that by continuing to have that engaging dialogue, really listening, being non-judgmental, and really coming to where people are so that you can, break those barriers.
Dr. Cheatham, you and I have talked about the conversations you've had to have with your patients as well. Dr. Syed mentioned this, of course. You get so many people coming into your office asking questions about misinformation. And if they asked you directly, why would you put this in your body? What would you say to them?
So I think, again, as you said in my intro, it's really about connecting with your patient. So if that's a direct question to me, I think it's a fantastic question. That why would I put it in my body? It's because I did it. I took the vaccine, and I'm sure all of us did. That we really want to be able to protect our loved ones. We really want to be able to meet with them, to enjoy our time. We want to be able to go back to some semblance of normalcy. But really, it's about trusting in and conveying that you trust in what has happened. I trust enough in the science behind what was created to protect me, to protect you, to protect all of our loved ones, so that we can all be together and we can go through this. There's so many people that we have lost, a lot of loved ones that we have lost. And had this vaccine been here even earlier, we wouldn't have lost all of those. And so it's really about understanding and getting on that same level, just like Dr. Syed said, is like being able to meet them where they are and help understand. So, a lot of times I always ask the question back, what is it that concerns you about it? and really addressing that. I did it because I want to protect my loved ones. I want to be able to be with them. I want to be able to go to graduations and events and be able to take part of all of these milestones that happen. And as we all know, that we haven't been able to do that. We haven't been able to be with our families during the holidays. We haven't really been able to go to church and be with our congregation. And that's what we really want to get back to. And so I trusted enough to put it in my body. And I would hope that they would trust my expertise, but really, ask me the questions, so that I can help get them to a good informed decision for them.
CEO Jenkins, you hear everybody talking about loved ones, and you have probably one of the more unique experiences among this panel in that you have two children on very different sides of the COVID pendulum here, a physician daughter who has had the shot and is well, and a son who's been a police officer in the middle of protests during the heat of the unrest, who has come down with COVID, who has not received a shot, and you, Mama Bear, couldn't even go there to take care of him. You had to send care packages to him. This is just illustrating this point of how we can't even be there for our loved ones in their time of need because of COVID. Talk to us about that experience and what it's been like and what you've learned and what you hope other families will learn from that experience.
So for those of us who have family, we are communicating in many different ways. So for some of my children, my oldest daughter, she's a direct caller. The doctor daughter, we're texters. And so it's interesting how we've communicated this. And I felt terrible that our youngest one, who is the police officer in Cincinnati, Ohio, came down with COVID. And I asked him, have you been wearing your mask 100% of the time? He goes, well, and I just thought, well, what didn't I do to help him see? We even have to help our families from this perspective, understand how to keep yourself safe, how to distance as much as you can. He does now. But when he became ill, then we started having the real conversation, it was out there. And then David, this is how this works. This is how the disease works. This is how you catch it. And every single person you come up to could have it. You must protect yourself. And then he thought, well, I had it, and now I don't have to protect myself anymore. Ugh, the misinformation. And to understand my daughter, the physician, she said it just saddens her. She said it is such a burden as a physician, a young physician, right? And she says, Mom, she said that, some of them are listening to me and can't get the care they need or can't get to the vaccine. And she said, Mommy, it's stressful. And I just pray for all 5 of them and our oldest daughter, they have 1 child, they've been at home, she's a professional. We want to end this for our families, for our extended families. I've got aunties in Atlanta and Alabama and Pennsylvania who are 70s, 80s, and as of yet, they have not yet been able to get there for their vaccines. We have to help our families and our friends. This vaccine will slow this tragedy. And so we have to talk to our families, talk to them off. Do not assume that your families automatically trust what you're doing. I got my vaccine first. My kids saw it on Facebook, but they were not as informed as I thought, I think. And so we have to make sure that we are telling the story in every way. I am in a Christian group of 11,000 Black people. And I put that shot on there, and about 80% of the people were like, oh, let's watch what happens to you. And then some of them were like, I can't believe you don't have faith in God about this. I can't believe, And so we still have to keep telling the story. Day after day after they watched, they would ping back, are you okay? And I just kept telling the story and grabbing information from doctors like Dr. Cheatham, Dr. Syed, just grabbing information. Here's what Dr. Syed says about it. Here's what this says about it. Here, I had no symptoms. And we just have to keep telling. We cannot give up. Keep telling that story to our children. It makes us worry in a different way when it's our own family. And you can't go, I can't check on him. He didn't even have a thermometer. Oh my. And so we just wanted to make sure that our kids and our loved ones are okay. It's a big burden, but you know what? That's why we're here. That's why we're here, to tell that great story. All of us on this panel, Dr. Tuxton, he's just been such an amazing supporter. And so every time we tell it in every way, Leslie, I can't thank you enough. We will keep telling the story so our families are safe.
Before I transition from you, CEO Jenkins, I asked you a question last night, and you had good information about this that is worth sharing. And that is, there are people who have noticed that Howard University has more slots open for vaccines. And so the question for you was, is there a direct correlation between vaccine hesitancy in this, or did you get more shots in? Is there more availability? Can you tell people right now that there is more availability because you received more shots?
So we open up when we can. All of the hospitals are working with DCHA, the DC Hospital Association, and of course, DC Health. We are following their guidelines. And when we get the opportunity to open up, we open up. So that's why it's kind of a stutter step here and there. I see Dr. Cheatham is nodding. We're all nodding. This is what we can do. We are really, we're responding when we can. And so sometimes you'll see that, that we'll have some room, and then sometimes you'll see that it stops. So we're really just responding when we've got vaccines. It's hard to tell, and Dr. Tuxton can probably respond better. It's hard to tell where this hesitancy is right now until we get some bigger numbers. But what we're seeing is we are getting some good responses.
Dr. Tuxton, do you want to take that?
Well, again, as I said, that our experience, at least around the country, is that almost everywhere that we know that there are vaccines being made available, the supply is less than the demand for the Black community. That is also being complicated by two other related phenomena. Number one is that it has been challenging for people of color to sign up for the vaccine administration, especially when those signups require online capabilities. A lot of times our communities don't have robust internet connectivity, or we don't have those computers in our homes. Also, we find that there are other more well-off, privileged people who somehow seem to be able to navigate the systems around the country better than African Americans. And we are seeing people who are jumping the line all across the nation, who are swooping in to take doses that would have gone to the Black community for themselves. And so I think that this is one of the most important points we need to make, Leslie, and that is this. It is extraordinarily important that we do not allow this idea of Black hesitancy to take the vaccine to cause those who are responsible for making sure that we have administration of those vaccines ignoring the Black community because of this sense, well, they don't want it anyway, so let's give it to those who do. That is one of the things I am most concerned about, particularly in those communities where we're already seeing the voter suppression activities that have been following the recent election. This is going to be tied very closely to that. So we will have to be very strong and fierce advocates for the Black communities to have its fair and equitable access to these vaccines.
Dr. Syed, we talked about access before, and I know one of the things that was a concern to you is that at the point where more of these vaccines are going to be flooding our communities and spaces where we can get access to it is sort of the period of Ramadan. And will there be some hesitancy on the part of those within the Muslim faith to take this vaccine during that period of time? How are you working to help ensure that that is not the case?
Absolutely. So what we're doing is we're trying to be proactive and think ahead. Just like, we're having to undo a lot of the misinformation now, we're trying to stay ahead of it by reaching all communities, all groups, and by having this plan in effect that, we're in anticipation that, during Ramadan, where Muslims, around the world and in the US are observing the fast during the daylight hours, those would be technically the times when vaccinations would be provided. So we have to really engage with the community, throughout the nation and throughout the world to let them know, first of all, that the vaccines are permissible and that there is no ingredient in these vaccines, no components of the vaccines that are forbidden to them religiously, and that vaccinations do save lives. We know that nobody has died from a COVID vaccine, whereas, thousands of people are dying every day just in our country alone from COVID-19. And we have to come up with strategic plans where we can offer vaccinations to Muslim Americans, after when they break their fast. So, it's a lot of public-private partnership. During the daytime when people are fasting, we have to really engage with them and let them know that if they have no other medical reasons for not getting vaccinated, that they can, go ahead and proceed with the vaccination. But it's all about community engagement. It's all about preparation. It's all about education. And it's, a work in progress. So every day, we're out there really educating the public and the masses and working, on every level, federal, national, local levels, to ensure that people know what are the needs of the community and how we can make sure that there is vaccine uptake and build that vaccine confidence.
It is one of the reasons why we have this broader conversation about cultural competency in these conversations about the vaccine. So Dr. Cheatham, we sort of did an audit here of some of the questions that we've been getting from people and some of the questions that we've even talked about amongst our panel. And let me run them by the four of you because you've heard them all. Why was the vaccine created so fast? What are the side effects? Should you take this vaccine even if you've had COVID? And why do I have to wear a mask even after I get the vaccine? These questions make up the bulk of the questions that we are getting from people. So why don't you just start in?
Okay, thank you. You're absolutely right. We get those questions all the time, especially in all the various forums that we participate in. So I think the first thing is, why was it created so fast? We're talking about mRNA vaccines and that we're able to create it faster because it's the type of vaccine that we made. However, what I've always told people and what people can relate to is this is a pandemic across the world. Everybody is really trying to solve for this one problem. And so you have a group effort. If it was just one state working on it and no one else working on it, that progress would be a lot slower. But we've been working on the science. This isn't new. This isn't witchcraft. This isn't something we just made up or magic. This is science we've been working on. But now you have the world helping you work and sharing of information. So that's why it was created a lot faster than we have done in the past. But we haven't skipped any steps. The science was followed along the way. It's just that you have a lot more people working on solving the same problem. There are lots of side effects out there that you hear, and should you take it again? Should you not take it again? There are going to be side effects with any vaccine, right? And we know that. And that's why we're observing when people, after you receive the vaccine, you observe for 15 minutes. It's because we want to make sure that everyone is okay. But again, these are normal side effects that we can get from every vaccine. There are a few rare side effects that do happen. But again, there are rare side effects that can happen with anything that's out there. Again, millions of people around the world are receiving the vaccine, are doing fine. The panelists here, we've gotten our vaccines, we're doing fine. You can expect some fatigue, you can expect some arm soreness, and that's okay. That's normal. It's okay to do that. And we still want you to get the vaccine. The only true contraindication of getting the vaccine is if you've ever had some severe side effect, immediate reaction to a vaccine in the past. But really, we would recommend that you talk to your doctor, right? Talk to your doctor. They know your own conditions and really get the recommendation. But I'm going to tell you, more often than not, they're going to tell you it's better to get the vaccine than to get COVID itself.
And you should get this vaccine even if you have battled COVID, correct?
Absolutely.
Yes.
So even if you've battled COVID, you should absolutely get the vaccine. And also the other question we get is, I have diabetes, I have high blood pressure, which we know affects the African American community disproportionately to the majority. And so those are the people that really need to get it. You're more susceptible to other conditions, and we really want you to be protected. So absolutely, that should not be a reason why you don't get it.
And you still need to wear a mask even after you've been vaccinated. And to be clear, the panelists on this panel have had their vaccine. The moderator has not. So that's why I'm asking you.
Yes. So you definitely should continue to wear your mask. You should continue to social distance and hand wash, even despite getting the vaccine. We still need to protect everyone. So it's important that you continue to do that as everyone continues to get their vaccine.
There's some other really great questions coming in. One is about, can you compare the Johnson & Johnson vaccine to Pfizer and Moderna, and which one would you recommend to the group? Do you recommend the one you can get, or do you pick and choose which one you get?
We do recommend the one you can get. All protection is protection. And so all science is science. We want you to be well. So that's my one statement. Take the one you can get.
Yeah, I have to agree with that 100%. You know, that's really the recommendation right now is any vaccine that is offered to you, you should really take. All of the vaccines have been proven to prevent death. All of the vaccines have been proven to prevent hospitalization. I mean, you're really getting to an endpoint that is phenomenal. That's what we want. We want to save lives. So at any point, if you are eligible and if you're offered the vaccine, please go ahead and take the vaccine.
Here's
just
another
to
question.
piggyback off, I'm sorry.
Go ahead, Dr. Cheatham.
I was
I'm
going to
sorry.
say, just to piggyback on CEO Jenkins, what I would say is we are very limited in the supply that we get. So we get what we're given and we give what we get. So there's not a lot of choice in what we receive. So, you know, as we receive our allocation, we are opening up every single appointment slot that's out there to be able to administer every single vaccine. So if you're eligible to get it, get it. Get whatever you can get.
I'm going to try to move through a bunch of these questions because there are a lot of them and we don't have a ton of time left. This is important though. So there are 2 doses, right? Obviously of this. And there are questions about, will the booster be different based on variants in the future? What's the best strategy given the variants that we know are out there to get this vaccine or a booster?
So we do know that, first of all, the first 2 doses of vaccines that we have available to us now, Pfizer and Moderna, are 2-shot vaccines. The Johnson & Johnson one, hopefully it'll be approved very shortly, is a 1 dose. And so there's a very big difference there. Will we need to have booster shots based on variants? This is an important question, and it is very likely that that may have to occur down the road. We are in a desperate race against time right now. As we try to get enough of the population getting immunity, either because they have currently high levels of antibody in their body because of exposure to the disease or because they were vaccinated, before this virus mutates further and changes so significantly that the current vaccines will not be effective. Thank God we're not at that place yet, but we are in a desperate race. And so I think that it is reasonable to anticipate that over time, just like when you have the flu, you have different, each year, you have a different formulation of the vaccine. That may well be what happens here. So we will see, people are monitoring it very closely, and the production capacity is prepared to modify as the events dictate.
And I just want to chime in, add to that a little bit that right now, the Pfizer and the Moderna vaccines both have been tested on the common variants that are, have been discovered. So the B117 variant, which was first discovered in the UK, and the B1351, which was discovered in South Africa. Both of these vaccines have been shown to be effective against these variants. The B1351 has shown a slight decrease in efficacy, but they don't think that really translates into not having protection. So the vaccine itself gives you such high antibody levels and such high protection that even though it's a little less effective against the B.1.351, it's still enough to give you protection. So the goal is, again, to really be ahead of these variants. We know that they're, in our community, they're around and they are spreading. So continuing vaccination so that we can prevent these variants from being, dominant ones. But even if they are, we know these vaccines will protect you against them. And the important thing that Dr. Tuckson mentioned before is that these vaccines, the mRNA vaccines, they have the capability of being adjusted rather quickly to really, have suit a new variant. So in the future, if there is a variant that becomes dominant that the current vaccine is not good for, they can adjust the vaccine so that, we may need a booster for say the following year if there's a variant that becomes, the dominant one. But for now, these vaccines are effective for the current variants that we have circulating that are more common. And so we should really promote vaccinations to get ahead of that.
Is it too early to know to the group whether these shots are in our future for the near future? Meaning, will these COVID shots become like flu shots each year, potentially?
Most of the predictions that we have from the epidemiologists is that this disease may well become endemic in our society. Endemic is just a way of saying a common element that we will deal with. And of course, it will change and it will modify. But know well that we are in a very intimate relationships between human beings and the animal population. The more and more that urbanization around the world occurs, the more that global warming destroys habitats for animals, the more humans and animals are brought close together. This is what is going to be the norm going forward in our world, of the transfer of these kinds of viruses from the animal world into the human world. And so we need to be ready and understand that we will have many challenges ahead of us as the society moves forward. This particular virus, we think, may not go away completely. And so we will perhaps see that this may be kind of like the flu. We don't know for sure yet, but these are the things that we are watching. But the point that we need to make is that we will have to make a significant investment in our scientific infrastructure to make sure that we are tracking these viruses around the world carefully, specifically, and that we have the mechanism, as has been demonstrated with the COVID-19 virus and the vaccines that have been developed, thankfully so quickly. We have to make sure that we have the apparatus in place to be able to respond as quickly as we have done in this case.
There are questions coming in about people who are immunocompromised, so they may have cancer. There's also a question that has come in from someone who has a relative who has sickle cell disease. What advice do you have for them about being vaccinated? What do they need to know?
The good news is that that the clinical trials, and I so love Reverend Whatley for his energy at trying to increase the number of people of color who participate in these clinical trials so that we will be able to answer the kind of question you just raised, Leslie. And we do have, thank goodness, enough people who have had sickle cell or other conditions, pre-existing health conditions, who have been immunocompromised and otherwise. We can say that they should get the vaccine, that it is safe for them and appropriate for them. And so we are able to make that statement because the research tells us the answer to that question.
Dr. Cheatham, did you want to weigh in?
I think Dr. Tuckson said it very well, so I absolutely concur.
There's another question here about whether or not there are teams in place to make sure that the vaccines are getting to people of color who are not able to register for them. Dr. Tuckson, Dr. Cheatham, Dr. Syed, Dr. Jenkins, all of you have both the big picture and the very hands-on view of what's happening now. Are you hearing about any other entities that are forming to help close these gaps to the group?
Yeah, I'll start. Maybe my colleagues will chime in. I am really pleased that the Black Coalition Against COVID has been partnering with a number of community-based organizations, faith-based organizations, and the National Medical Association to work with the CDC. So tomorrow, we will have a 2.5-hour workshop with the CDC and the White House just on this issue. I am very confident and, quite frankly, encouraged by the responsiveness of the Biden-Harris administration to assure the Black community that community-based organizations, faith-based organizations, will be centers for vaccine administration, conveniently located to African Americans, particularly those who are homebound, who cannot travel, or who feel that they will be more confident in their engagement with vaccination if it occurs in their trusted sources. So I will say to you, Leslie, that I am extremely confident by the reception we have gotten from the Biden-Harris administration across the board, and you will hear some major announcements coming from them, I think, in the coming days.
Dr. Syed?
I have to agree with all of that. There's been a lot of work that's being done, as I mentioned before, similar to what Dr. Tuckson is saying with the Interfaith Roundtable that I sit on, really driving, community faith centers as vaccination sites. The Islamic Medical Association of North America has partnered up with FEMA to provide volunteers for mass vaccinations. American Muslim Health Professionals is working on educating the public, but it's really driving these community centers, faith-based centers as vaccination sites, because this is how we can have a twofold effect: build the vaccine confidence and really provide access to vaccines, because that's the biggest hurdle. People can't sign up for vaccinations, they can't access the vaccines. So there's so many barriers, and we have to bridge that gap.
I'll add boots on the ground right now while we're trying to give vaccines. We are calling patients. We are calling anybody on the books, and we know that they are Black and brown. So that's happening all the time. And that's how we're getting the numbers in. And I know for a fact that the hospitals are working in those manners. We're just on the phones, our teams, and we've sat back and we're calling to make sure that those who don't immediately have websites and can't search like that, we'll reach out to you.
Yeah, and I would have to also echo everyone that we are as well doing the same thing. It's really about just helping people navigate how to get the appointments. And so we're doing the best. We're calling, we're texting to ask, how can we help you get the appointments, and trying to get those appointments booked for the patients who really need it.
We're winding down our time, and I want to try to get a little bit more. I want to squeeze more out of this orange before we have to let it go. CEO Jenkins, there's a question from somebody who wants to know, is this mandatory? Do you get the sense that employers will mandate people to get vaccines in order to return to work? What's your sense of that?
Those are conversations that have been floating around a little bit. Right now across the country, of course, it's voluntary. I do not know of any organizations there might be some, but I do not know of any organizations that are making it mandatory. So therefore, we do have to win the hearts and minds and confidences of those that are in our employ or our community to get this done. So no, that's not where it is. But what we are doing is, so for instance, we've had wonderful conversations with our union representatives to say, let's talk about this. What are you hearing? And how can I work with you? And so we're arm in arms with our union representatives. Just had another meeting yesterday. See what you can do to help make sure that our employees and their families know what they need to know and have the resources that they need to have.
We are getting close to the end of this, and Dr. Tuckson, I know I wanted you to kind of give us a final word, but before we do that, Dr. Cheatham, Dr. Syed, any last thing you want to add to the conversation?
The last thing I would say is, really, we implore all of you to really help spread the communication, to help get rid of all this misinformation and really be advocates and ambassadors of the COVID vaccine. Really, we're talking here about COVID hesitancy, but we really want to switch that conversation to COVID confidence, right? So we really want everyone to take part of this and help us spread the word. Dr. Syed?
I would just echo with that as well, and just really want to reiterate the message that, we really want to save more lives. We have lost far too many people to this virus, and we just cannot lose any more people. And when we have something now that is very promising to really get ahead of this, we just want you to know that, there have been no corners that have been cut on the safety of these vaccines. They have been screened and vetted, and they've gone through all of the safety profiles. In fact, the manufacturers had signed a pledge in fall of 2020 to hold them to the highest safety profiles. The FDA had then asked for 2 months of data instead of 1 month of data. And now we've got thousands of people that were in these trials that have been followed for months and months and months that have had no serious side effects. And we've got millions of people that are getting vaccinated that are doing just fine. So for all of the people that are listening, we're so happy that you're here. And what we want you to do is to take this message home and share it with your friends and family, because we care about all of you and we want all of us to get through this, and we want all of us to get back to some sense of normalcy and to live healthy lives.
Dr. Tuckson, I'll let you have the final word, but I do want to say, this is Black History Month, and there is a woman who has helped to make history as part of this effort to create this COVID vaccine that we know about. And so if you haven't heard the name Dr. Kizzmekia Corbett, you should. You should know who she is. Dr. Tuckson, I know you know who she is, but why don't you send us home with a final word?
Good. Kizzmekia Corbett, by the way, is the woman that was in Tony Fauci's lab who developed and had a lot to do with developing the Moderna vaccine. So you're right on spot there. 2 quick things. Number one, that remember for all of those who are still bringing up Tuskegee, the shame of Tuskegee was that men with syphilis were denied access to treatment. That was the point. There was a drug that would treat those men, and they were not allowed it. Here we are. If you care about Tuskegee and it makes you angry as it should, then make sure you know you have a drug that will save you from this disease. Do not let what happened in the past happen now. And that is you be denying yourself access to it. The other thing we want you to be really, really clear about, this is a critical moment that we're seeing cases starting to come down. We may be starting to turn the corner, but it's a race against the new variants. So please wear your mask every time you go out. Please make sure you do more than 6 feet of social distancing. Do wash your hands. Do not get caught indoors in bars and restaurants or being around people who you do not live with, and do not let people into your home who do not live with you. Ladies and gentlemen, this is the critical moment. We are about to hit 500,000. We will get to 600,000 in about a month and a half, 6 weeks. That's what's on the table now. If you love Black people, if you love all people, do the right thing.
And there it is. And I want to thank all of you, our panelists, CEO Jenkins, Dr. Tuckson, Dr. Cheatham, Dr. Syed, for really an enlightening and inspiring conversation, because so many times we don't know the way out. We can't find the light at the end of the tunnel. Here, we can see it. It's within reach. We have to just build the confidence for folks to believe in it, to take in it. And I can tell you, when they call me, I'm going to say, which arm you need? Do you need the right arm, the left arm? Or you want it this side? Do we need theme music? However you want to do it. We want to build confidence in this vaccine because we want to get back to lives that as we knew them. So thank you so much for your time and your heart and your expertise today. You are leaving us all more enlightened than we were an hour ago, and we appreciate that. We must thank our partners, the COVID-19 Vaccine Education and Equity Project, and of course, Kaiser Permanente, for just being incredible ambassadors for us. And we thank you for sending us your questions, for spending your time and your heart with us today. If we did not get to your questions, we will work in the next few days to answer them directly. And we also want to tell you that we don't bring you here without giving you one last thing, and that is access to resources. We have a resource that will help you navigate the system to help you sign up for a vaccine if you live in DC, Maryland, or Virginia, plus any of the things that we talked about today, what you want to go to, and you'll see it on the screen, but I'll tell you now, it's going to be covidvaccineproject.org/townhall resources, or resource, not resources, for the information that we discussed today. We're going to put it up again at the end of this of our time together, which will end in just a moment. But we also want you to know that your health matters to all of us. It really, really does. It matters to these physicians who have given their life's work to make sure that there is equity in this process. And it matters to us at WUSA 9. So again, thank you so much for your time today. I hope to see you at 5, 6, and 11 o'clock tonight, where we'll talk more about COVID and what we all need to do as a community to get to the end of this. So again, thank you to all of our wonderful panelists. Have a wonderful day to everyone else. And if you stay right here, we'll share that link for you that has the resources. Have a wonderful rest of your day. Thank you all.